Good day, my name is Refilwe Mohale. I'm the Executive Director at the Pharmaceutical Society of South Africa in South Africa. Our pharmacy-based vaccination programs in South Africa are regulated by the South African Pharmacy Council, which is our regulatory body, and the National Department of Health. Pharmacists who wish to offer immunization services, they have to qualify, they have to attend a course which is called Immunization and Injection Techniques course, and they become accredited by the Pharmacy Council. Once they're qualified, they need to then obtain a permit which we call Section 22A15, which is issued by the Department of Health. And after that, then that permit allows the pharmacist to acquire, to possess, to use, and to offer immunization services in their pharmacies. Though the vaccines that are allowed for pharmacists to administer, they are under the Schedule 2 status. They don't need to be prescribed, so they can be accessed directly from the pharmacy. Pharmacists are allowed to administer vaccines that are commonly used for public health immunization services. And the first one is vaccines that are given to children from infant to an age of 12 years old, from birth up. And those vaccines are the ones that are preventing for the prevention of TB, diphtheria, whooping cough, diarrhea, all those kind of vaccines that are meant for children. But they are also allowed to administer full influenza vaccines, including the COVID-19 vaccines. Unfortunately, not now. They can't administer vaccines meant for travel, as those ones they need to have a doctor supervising them. So it's only the vaccines that are meant for children and for the influenza vaccines. Like I said earlier, they don't need prescriptions because they fall under the Schedule 2 status, so they don't need to be prescribed. That means patients can come in and ask for a vaccine, which the pharmacists are allowed to administer, and they can get those services at that very same time. So the policy for pharmacists to start administering vaccines started around the early 2000s, but at that time there were still just policy discussions over the recognition of the need to expand the services. And around 2008 or so, then there was a discussion of expanding the scope of pharmacists' practice, and that was guided by Pharmacy Council developing the Good Pharmacy Practice Guidelines, which also included immunization and injection framework into those guidelines. And around 2014, the accreditation of the vaccination programs was done, and then we started pharmacists registering for the course and then qualifying and getting the permit. And then I think 2020-21, during the COVID-19 pandemic, then we've seen the recognition of pharmacists offering those services as a government or National Department of Health requested that pharmacists should also be part of the team that offers the immunization services or vaccination services, as there was a huge demand for the vaccines and the other healthcare workers were under a lot of pressure. So that service was expanded to pharmacists. I think that also then increased or made sure that the pharmacist's role in immunization is very important. It solidified the role of pharmacists in immunization. The uptake rate were increased, and there was a huge accessibility for the vaccination for the public, as they didn't have to stand in a long queue in one of the clinics. They can just go to a pharmacy at any time, because some pharmacies they open till late, so there was access. Number two, there was a huge influenza vaccine uptake. Those are the positives that we've seen the impact of the vaccine impact. Also, there were also the rate of COVID-19 vaccination was also increased by having that huge access by the public to the pharmacies, and obviously, the last one is public health reach. We manage to support the public health initiative as pharmacists. Pharmacists in South Africa are reimbursed for the vaccination services via 3 or 4 models. The first one is when the patient pays out of pocket. Those patients that can afford and they had money, they can just pay out of pocket and just pay directly to the pharmacist. The second one is the patients that are insured, meaning that they have medical aid schemes. So the medical aid scheme will then pay or reimburse the pharmacist for the services offered, which is guided by what the Pharmacy Council has determined as the fees that a pharmacist can levy for services offered. And then the vaccine itself, we use what we call a single exit price, which is what they will reimburse pharmacists for that medicine. And the third one is via government public initiatives, where the pharmacists then are given vaccines by the Department of Health, and then they get reimbursed for the administration services, which is what we now call the public-private partnerships, so the triple P partnerships, where government offers the treatment or the vaccines and the pharmacists offer the services, and they get reimbursed via that system. Opportunities that are brought by the vaccination services. One is the expanded access to healthcare, which now the public has access to these services. Now it's more expanded to other facilities, which include pharmacists. Number two, the increased role of pharmacists in the public health sphere, where they now increased by offering the services. The third one is the public-private partnerships. We have seen the collaboration, how it has helped to expand the immunization services in our communities. Number four, the technological integration. Pharmacists have systems that are very advanced that are linked to the medical aid schemes, but also we have seen the inclusion or the expansion to the digital digitalization of records of patients. So that is also one of the benefits or opportunities that we see. And I think lastly, we've seen the growing demand for the services from the pharmacists. And then in terms of the challenges, there's regulatory limitations, as the pharmacists, they need to now go and train before they can start offering the services. So your 4-year degree does not permit you to just offer the services. You need to go for training, and the infrastructure as well is a problem, because you need to have a compliant infrastructure to offer those services. The third one is the training and capacity building. Some of the pharmacists are still not willing to partake in that because of the cost that's involved in terms of the training. Also the vaccine cold chain and cold chain equipment, which might be expensive, where they can't. We've seen the bigger chain pharmacists can afford to do that, but the smaller independent pharmacists, they can't afford those cold chain equipment. That is why we've seen those. So those are the kind of challenges we are facing.